Sumerian disease theory, in other words, what was the cause of disease, again relies on spiritual and mystical forces. That there were numerous gods and goddesses that controlled health and disease of people in their society, and that disease was a punishment for some kind of infringement or sin. That if you displeased the gods, they would remove or retract their protection, and human beings would fall prey or fall victim to any of the disease-causing devils and ghosts, which people at that time in that part of the world thought were around them all the time and were present and ever present in that part of the world. If you were sick, it was because you had some kind of moral or ethical or spiritual defect. In fact, sometimes even up through the 19th century and the 20th century, this concept still was occurring even in modern societies, that the reason that you were sick was because you were a bad person. And so this goes all the way back to the concepts of causes of disease as described in ancient Sumeria. That disease and illness was a condemnation, and it called for a moral cure, not just necessarily a physical cure. Treatments were mostly magical and religious at that time in ancient Sumeria. Even though they still had some practical uses of minerals and salts, we don't see the complex, sophisticated treatments that will occur 1,000 years later or so when we look at ancient Egypt or even ancient China. Around 2600 BCE, we see artifacts like the Babylonian physician's seal and the ancient cuneiform writings that ascribe causes of disease to invisible forces. So we still see and hear about invisible entities causing disease. But of course, nowadays, we would associate those invisible forces as being invisible microorganisms. We get to another part of that same area in the Middle East and the Babylonians. Babylonian medical care was far more practical and rational in comparison to their Sumerian neighbors or ancestors. The Babylonians' observed disorders were based on requiring some kind of plant or mineral pharmacology. That there were disorders that they would use a physician for treatment. There were other disorders that were regarded as being due to supernatural problems or causes. And this would require the intervention of a priest or some kind of spiritual healer. There were some conditions that ancient Babylonian medical folks really couldn't figure out which or what was occurring. That they really didn't have any kind of basis or association with either sort of physical disabilities or spiritual disabilities. And so those disorders remained and were regarded as mysterious. They couldn't quite tell what to do for those patients. There were two major collections, what we think of as medical encyclopedias or textbooks, that Babylonians used to treat disease. The first collection was considered to be the diagnostic series. Had symptoms of names of diseases and diagnosis of those diseases, prognosis, causes, and whether it was due to physical or supernatural, essentially sources. The second collection, the therapeutic series, recorded essentially pharmaceutical treatments. hundreds of prescriptions or recipes, listed usually starting from the head down to the toes. And there were essentially documents that had multiple references and resources for very specific diseases and symptoms. Again, a much more sort of organized and rational approach to the treatment of disease, at least some diseases. Ancient Babylonian medical philosophies included some concepts that we can relate to today. They recognized key organs within the body as having certain kinds of attributes. That the heart was the seat of the mind. We still use that concept today. We talk about memorizing something by heart, or that we take things to heart, or that we are heartbroken. We associate different conditions with other body organs even today, and they recognized that the liver was the seat of emotion. There used to be a phrase that we talked about somebody's bilious nature or their bilious attitude. Because they kind of had a caustic, not so pleasant view of the world. In modern Arabia today, there is a phrase that's still used that essentially is interpreted or translated to mean causing your liver to flip. In other words, not making you feel very good inside, associated with negative feelings. In addition to the heart and the liver, ancient Babylonian physicians also associated different conditions with the stomach. They identified the stomach as the seat of courage. Well, we still use that today. We talk about saying someone has the guts to do something. Or, do you have the stomach for it? Or if we're not very courageous, we might get butterflies in our stomach. They recognized in ancient times the uterus was the seat of kindness. Sometimes that's been a little bit more difficult or tricky to make some kind of modern association with, but actually we find that perhaps they were thinking, or we could associate today, that the uterus is the body organ associated with the female, gentler, kinder sex or gender in human beings. Babylonians administered drugs in every possible way, minus injecting something into the human body. They made mixtures, potions. They inhaled vapors and smoke from burning plant material. They made ointments, liniments, and the basic difference between an ointment and a liniment. An ointment would be sort of a greasy mixture, and a liniment would be something made formulated in oil or some kind of cream, if you will, but usually an oil-based combination or formulation. They also used enemas and suppositories as a way of treating different conditions. For diagnosing diseases, they might use this type of tool that's essentially a artistic rendition of an animal's liver, a sheep liver. It wasn't unusual in ancient times for physicians or physician priests to sacrifice or kill an animal and take the entrails or the internal organs out of that animal and use it to foretell or diagnose disease. Especially animal livers tended to be very popular in the diagnosis of disease in ancient times. The facsimile, or this artistic version of a sheep's liver, you can see that it's been marked off in different little sections, and you can just barely make out the cuneiform writing which describes a change that a physician priest might see in that spot or in that place on that sheep's liver, and there's a description in cuneiform writing of what that means. And that's how the ancient physician priests would use these animal livers. They would look at different spots or different places on the surface of that liver, trying to figure out what was wrong with the patient and possible treatments to make the patient feel better. This structure, this carving, is roughly almost 4,000 years old. It's estimated to have been made roughly 19 to 1800 BCE. It's amazing that it survives even to this day. Symbols that we use even today are sometimes derived from ancient sources like ancient Babylonian or ancient Sumerian medicine. The practice of pharmacy and preparing combinations of chemicals and plant materials to be used as treatments has been around for thousands of years and was first developed by ancient Sumerian and Babylonian physicians. At roughly 2100 BC, the world's first recorded prescription is found on this clay tablet. Now, the clay tablet, of course, is just a little small device, or fortunately, it's just a single example, but since there was one found, it's presumed that you could find these kinds of prescriptions for different ailments frequently in ancient times in that part of the world. When we're looking at treatments of neurological conditions, which was unheard of almost in any society back 4,000 years ago, we find that the Babylonians were the first to describe the clinical symptoms and signs associated with neurological and even psychiatric disorders. Roughly 1890 or so, or about roughly 1900 BCE, we see some of the first writings that describe conditions of epilepsy, stroke, obsessive-compulsive disorders, phobias, even psychopathic behavior and depression and anxiety. It's almost unheard of from ancient times for physicians or physician priests to associate medical conditions with these different neurological occurrences. Oftentimes in some societies or other areas of medicine in other countries, they would associate these neurological or psychiatric conditions to spiritual causes. But the Babylonian physicians and physician priests had apparently observed and were able to find treatments for many of these conditions, especially when associated with some kind of injury. But they certainly seemed to know that there were natural or physical reasons for these neurological and psychiatric disorders.